In the previous video, I explained how alarmins released from stressed joint tissues keep inflammation switched on inside the knee. But in many patients, this inflammation does not remain local. It becomes prolonged, amplified, and difficult to switch off. To understand why, we need to look beyond the knee itself. Osteoarthritis is no longer viewed as a single uniform disease. One important subtype is called metabolic osteoarthritis. This form of arthritis is strongly associated with diabetes, obesity, insulin resistance, abnormal cholesterol levels, and hypertension. In these patients, the joint exists inside a systemically inflammatory environment. For many years, obesity was thought to worsen knee arthritis only by increasing joint load. But we now understand that obesity is also a metabolic and inflammatory condition. Adipose tissue or fat is biologically active. It releases inflammatory mediators that influence immune behavior throughout the body. If you want to understand knee arthritis properly, not myths, not shortcuts, but evidence-based options, subscribe to this channel. This channel is structured like a clinical consultation, not social media advice. Adipose tissue produces signaling molecules called Adipokines. These include leptin, resistin, and adiponectin. Adipokines influence cartilage metabolism, synovial inflammation, and immune cell activation in metabolic syndrome. This signaling system becomes chronically dysregulated. The immune system is primed. Think of your immune system like a fire alarm. The alarm is stuck on even after the fire is out. Insulin resistance does not affect glucose alone. It alters immune cell behavior, promotes oxidative stress, and sustains low-grade inflammation. When alarmins are released inside the knee, this primed immune system responds more aggressively and for a longer duration. This explains why inflammation in metabolic osteoarthritis fails to resolve. The joint is continuously exposed to both local danger signals and systemic inflammatory drivers. The resolution phase of inflammation never fully activates. Clinically, patients with metabolic syndrome often experience more persistent pain, more frequent flares. Here you see a normal HbA1c but raised insulin level. This is one of the causes of a metabolic flare. Poorer response to purely mechanical treatments. This is not due to lack of effort or complaints. It is biology. Exercise and weight reduction are essential, but they do not immediately reset immune signaling or inflammatory memory. That is why symptoms may persist even when patients do everything right. So, in metabolic osteoarthritis, treatment must address not only mechanics but also inflammatory signaling. This is where biologic approaches aim to modulate the joint environment rather than simply suppress symptoms. In the next video, I will explain how biologic treatments attempt to influence inflammation and immune behavior in knee arthritis and where their role begins and ends. Have you noticed your joint pain gets worse after a sugary meal? Let me know in the comments.